BMG Oncology has locations in 3 states and treatment centers across the Mid-South. And soon, the umbrella of care will have a central location in Memphis. On today's Health Matters show, we're talking to Jillian Foster, the Administrator of Clinical Oncology for Baptist Medical Group. Jillian, thank you for being here today. Now tell me exactly what your role is at BMG.
I work with our medical oncologists, our surgeons, and our radiation oncologists, and I work with them and their practices for operational issues and patient care.
So essentially at BMG, all of the oncology services are under one auspice or one umbrella, so there's continuity of care between medical oncologists and surgical oncologists, correct?
Right.
Now, what makes Baptist Cancer Center different than other centers?
We think that several aspects of our service make us top-notch for our patients. We have multidisciplinary clinics such as our thoracic clinic and our malignant heme clinic, where we have physicians and surgeons, nurse practitioners, and other clinicians who discuss as a team each patient and the best plan of care for them. We also have nutritionists who can take requests from patients or physicians and develop a personalized nutrition plan for our cancer patients. We are also very proud of our Survivorship program, which acknowledges that cancer care is a lifelong journey and deserves support and follow-up before and after treatment.
And I think that's very important because I see in my practice patients that come to y'all and are treated and successfully cured still need the follow-up emotionally and psychologically of dealing with what they just dealt with their journey through cancer. Mm-hmm. Now, what are some of the services that are expanding with the Cancer Center?
Today, we offer clinical trials to our patients all throughout the region in Tennessee, Mississippi, and Arkansas. With our partnership with Vanderbilt Cancer Center, we will begin to expand the number of clinical trials offered to our patients so they can continue to get those types of services right at home without having to leave their community.
Well, that is so important because I have a lot of patients that ask when we diagnose something like that about whether they should go to Vanderbilt or whether they should go to MD Anderson. But you're saying we have the same facilities and offerings that some of these places may have.
Right.
Well, what do you see as far as the future with Baptist Oncology Group?
We expect to see that oral chemotherapy treatments will be a trend that increases. We will have a commitment to our patients to continue to monitor side effect profiles and compliance even for oral chemotherapy, and we would want to make easily accessible options to our patients for oral therapy. Also in cancer care, genetic testing is a hot topic, and the Baptist Cancer Center has genetic counselors who stay up to date and current on genetic tests, both diagnostic and treatment tests.
How do patients access you? Is the best way to go through their primary care doctor? Say they have a concern about they want to get screened for malignancy, or they have a genetic predisposition for something. How do they get into your system?
Mm-hmm. Our clinics are all going through the BMG referral line now, and so that number is working well to take patient requests and get them to the right oncologist, whether for screening or for treatment discussions.
Great. Well, thank you so much for being here today. And BMG has so much to offer in different specialties, and especially in oncology. And that, as Jillian just said, is expanding daily. So we're very fortunate to have a organization that we have here in Memphis. This is Dr. Mark Castelaw with Health Matters. Stay with us because we got more exciting guests on our show today.